Welcome to the Divine Radiance Project with your host, Stacey Turner, and co-host, Emma McDonald, where we share all about reclaiming your radiance as women in business, holistic health, money, mindset, and juggling it all around mum life. A place for women to learn about financial independence, entrepreneurship, and balance. From women who aren't scared to speak their mind and their truth. It's time to shine your brightest self and be the lighthouse.
Welcome back to the Divine Radiance Project podcast. I am Emma McDonald, as you probably already know. And today I'm here with the beautiful Dr. Shanaz Morkas, who is a homeopathic doctor, and we actually work together. So I will tell you a little bit about our story and how we got to know each other in a bit. But first, tell us about you, Shenaz. Thank you so much for joining us.
Thank you so much for having me, Emma, on this podcast. I'm absolutely privileged to be here. What would you like to know about me?
We want to bring awareness around health. So
Sure.
Empowered health is something that we really stand for, but also empowerment for women, what women are able to achieve. And doesn't matter where you come from or what you do, or it's always going to be for the greater good of the other people, like for others and ourselves, right?
Oh, I love talking about that. Tell me how many hours we've got.
Yeah, exactly, right? No, I just love your story.
Now, women empowerment is definitely my favorite thing. And I must say, I'm very blessed to have this opportunity to where I am now. I come from a family of doctors, obviously mostly male dominated. I did have an auntie who was also a medical doctor, and she was quite a independent and outspoken person. And oftentimes me growing up, I used to see she was getting shunned out very often by the society and the rest of our family as well. But she was a doctor herself, practiced for some time. She was an educator. She used to teach psychology in universities as well. But it wasn't easy. It wasn't easy as a woman growing up being so powerful. And I guess deep down inside, she could be one of my role models for me to practice. My dad wanted me to study medicine. He wanted me to study gynec ops, which I did for a short duration of time. So my degree is BHMS, which is a medical degree where we study the same anatomy, physiology, pathology, surgery, gynec ops, a medical practitioner would. The difference is I studied homeopathic pharmacy. So our pharmacopoeia was different. And then we had an extra subject called organon philosophy, which was the homeopathic philosophy of practice. But in terms of experience, in terms of education, we get similar type of experience in education like a GP, a general practitioner would. It's a bit of a complex situation. So we study the natural medicine alongside with medical practice. So it helps a lot in terms of diagnosing, understanding how to read pathology, how to read reports, understanding emergency medicine. So where there is a need for surgery or where there's a need for medical intervention, and also our scope of practice when we have to prescribe natural medicine, how it complements conventional medicine. We learned a lot about that through our intense 5.5 years of studies.
Yeah. And did you find there was a point where you wanted to go more into the natural side of things? Like when you finished your studies and you traveled over here, what was that point of you going, okay, I don't want to be a standard GP, or I want to go into more of the natural side? What was that process like for you?
So when I came here, I did realize that there was a gap and lack of understanding of how qualified or how experienced I was in terms of my degree. And sadly, I also noticed that in Australia, the natural therapy was not as well accepted in the conventional world. So there was that huge gap, which is still there, but there was lack of awareness. And so when I came here, obviously, I still wanted to pursue working with women and children. And I did see, and I always knew about how homeopathy works so well for sensitive patients, for infants, for pediatric cases of eczema. So definitely that was always my passion. But there was that gap of how to prescribe when, and even for people's awareness in terms of can steroid creams be used when we're using homeopathy. So it's still there. I would say that gap is still there, but it's been probably an 18 years quest in trying to bridge the gap, in trying to get my patients aware that we can use both conventional as well as homeopathy medicine. At the same time, the accessibility of good quality homeopathic medicines, so my patients can get hold of them when it's required. Even emergency medicines, so some of the homeopathic medicines we have here for hand, foot and mouth and for school sores work quite well for acute infections and for immediate relief. So my quest still is to get hold of those medicines and we get more of that awareness out there in the society so people can get hold of them when needed. So I would say I'm answering that question. Yes, I think there's a lot of work that I had to go through, and still there is work to do in terms of awareness and accessibility.
Yeah. And that's what I love about you. We met, I don't know how many years ago now, like maybe two and a half, when I first came to see you with Aurora, which is my daughter, because we wanted. Correct. Obviously, I was a naturopath at that point, but I hadn't been practicing for mat leave. But I had learned about you from Stacey, actually. Stacey has this abundance of a community you learn about. All of these like-minded practitioners in your journey to finding wellness for the family. And I had used homeopathics for myself in the past for a vaccine injury that I had when I was in my 20s. That was really my first entry into homeopathy. And I was sold, like absolutely couldn't believe the work, how powerful the medicine is. And I wanted to know more though, and I didn't know enough. And then when I met you and when we were doing treatment with Rora, and yeah, it was just so fascinating for me. You inspired me to go back and want to study homeopathy and Correct. Be able to bring another tool in my tool belt as a naturopath. And then what the other part to you is that as an empowering woman in a industry that can be very ego driven, you are not. I had come to you and I'd said, hey, I'd love to do some mentoring with you because I knew you would do that with students. And you were like, yeah, great. And you had no qualms about that. And then we clicked and now we get to work together. And I think that's a really, what's the word, like something that needs to be in this industry more, is that practitioners working together, the health industry overall, really, as you were saying, working with conventional medicine as well as natural medicine, but also from a practitioner point, taking the ego out of what we do, that Correct. There are enough sick people in this world to influence. And are everyone going to click? Maybe not. But I have to say that's not a value, what's the term, like a strength of yours that is really beautiful. And I think there needs to be more women like you in this space, because women empowerment in business is one thing. Women empowerment when it comes to business partners and empowering each other to do better for the greater good. That's, at the end of the day, that's what everyone should want, in my opinion, thanks. Like even from a health perspective. So thank you for that and all that you offer the community in Brisbane. You obviously have clients internationally and whatever, but interstate, it's just, there's not enough words to say that there needs to be more of you, Shenaz, I think.
And thank you, Emma. And it's true honor to have you work at More Care alongside with me as well. Because I guess as you, and I'd like to share that as well, I do believe in the value of care. I do believe in the value of inclusiveness as well. So one of the things that we talk a lot in More Care is about the shared care value. And what shared care to me actually means is that there is no hierarchy. It's all about working together as a team to deliver the best for our patients. And what that actually means is you may know something and I don't know, I may know something and you don't know. Keeping egos aside, we work together, brainstorm some ideas, try to get the best possible result for the patient. That is so important. So when you talk about ego, ideally ego shouldn't come in the place of care. And what I also believe, Emma, is that if we are healthcare professionals, if we anyone, like may it be natural medicine or whether it's conventional or any allied healthcare, the care factor has to be the most important factor. So you're doing it because you want the best for your patients. You're doing it because you're keeping them, their health, their needs first above yours. If you can do that, then you can deliver the care more effectively.
Yeah, absolutely. Did you find growing, like when you were studying, and obviously your dad's a doctor as well, was there any tricky conversations when you were saying that you were going into more of this natural side opposed to like the standard? Did you ever have hard conversations about that?
Good question. Obviously, my dad wanted me to practice as a obstetrics, and I did, and I was very blessed that I got my internship in the hospital which I was born in. And coincidentally, I also got a chance to work under the obstetrician who delivered me. She actually was retired, but she had to come for placement because somebody else was not available. And I was truly blessed to work under her. And that was always my father's dream. But this is a funny story that most obstetricians I worked for didn't have kids of their own. So that was one of the reasons I always told dad that something really doesn't feel right. What is it about them delivering babies that makes them not want to have kids of their own? And deep down inside, I knew that I eventually did want to become a mom. So I told dad that I can't see myself doing this long term, and how I enjoyed one-to-one interactions with patients, especially pediatrics, and seeing little babies, seeing infants, seeing newborns. And then dad said, in that case, we can see ourselves going into more of as a consultant. He was disappointed. So you're right. He was probably a bit disappointed, not so much disappointed for me practicing natural medicine, but more so that I was not going to be one of those people who was going to be working and affiliated with hospitals. So I was more looking at more private practice. And back then, we didn't know that I was going to be moving to Australia or anything of that sort. So we really didn't know where it was going to take us.
Yeah. Where did you start? Because you had a clinic before More Care, which is where we are now. Yeah, what was that transition?
So you mean in Australia or back in India?
Sorry, from India to here.
From India. So dad had a practice, of course, of his own, which also he inherited from my grandfather. So I come from three generations of medical practitioners. So dad inherited my grandfather's clinic, and part-time I was working at my dad's clinic. I was seeing women mostly. So dad was quite happy because with him being a doctor, there weren't many women clients coming in. But I used to practice in the evenings from 7 to 9, and dad started noticing a lot of women patients coming to me for health. So that was a good start. I practiced there for almost 6 months to 1 year, I think less than a year. And then I got married and I moved overseas to Australia. I worked here for some time. I came here for some time, worked on my license to practice as a homeopath initially. And I also did appear for the medical exam. And there was a bit of requirements for that. So I appeared for the first part of the written exams, and then they had to appear for some practical exams, and then I had to move to rural place, which I didn't go through because then I fell pregnant with my daughter, and then decided to take off the whole homeopathy. But then there was a short time I even moved to Dubai because Altaf used to live in Dubai and worked for Emirates Airlines, and for 1 year I had to appear for an exam there. I had to appear for a medical exam there, but then I was licensed to practice as a homeopath for a short time. I worked in one of the hospital setups out there as a consultant, also more as an outpatient department. I worked for some time, and then we moved back to Brisbane. So I was a little bit all over the place. When I moved to Brisbane, I worked for a homeopathic clinic in Brisbane, and I also worked for another clinic on the north side called Brisbane Live, which still I think is still there, and that was a more multidisciplinary clinic. So besides homeopathy, there was naturopathy, herbal medicine, as well as Chinese medicine. I love that experience. That was quite eye-opening to see other practitioners come together. And like me, there were other practitioners as well who were very inclusive, who were happy to work as a team to give the best care for patients. And that was actually my first experience of working with allied health practitioners with similar value. And of course, I could see the benefits with the patients, and I wanted to carry on that value into more care.
Yeah, amazing. And how old's More Care now?
More care, we founded into 2012.
Yeah. Okay.
That's 12 years now.
Yeah.
Okay. Quick.
And we'll talk a little bit more about homeopathics in a minute, because I'd love for you to talk us through the process of how Naturepathics came about.
Sure.
But as I said earlier, like, homeopathics has been a huge part of my life. But, explaining it, I find some people look at homeopathics still and as, oh yeah, that's a bit woo, no thanks. But I'd love your opinion on how you see it, how Naturepathics, which is your own created brand, your product, how it came to be, and what you envisage for it, or homeopathy for everyone.
You just summed it perfectly well. Homeopathy for everyone. That's exactly what Naturepathics is all about. As I mentioned earlier, Emma, my biggest quest is for patients in Australia and even overseas to get hold of good quality homeopathic medicines easily. Because I think the challenge is, and so for so many years, people have understood that they have to see a homeopath in order to get hold of the medicine. So it's like consultation before prescription. Now, that may be true for most of the cases, especially when we have to individualize the case. But then there are some remedies that we give often without having to know the underlying cause. So things like, as I said, for hand, foot, and mouth, for school sores, remedies for even simple things like cold, flu, simple rashes, those kind of acute remedies, people still go to pharmacies and GPs to get hold of, even if they don't want to. And truthfully, homeopathy does work quickly and effectively. So my quest or my reason of Naturepathics is that people can get hold of these remedies as a first aid. So instead of using paracetamol or any heavy steroid cream, they can still try out the rash remedy or the acute cold remedy before having to need something much stronger. Of course, I do understand there's a place for conventional medicine. As a doctor, I understand that they might need paracetamol or antibiotics as well. But when there are natural options available, why not use them first?
Yeah, definitely. And I think it's always coming back to that, treating the root cause and holistically that person. And
Absolutely.
that's what homeopathics, I think, does beautifully, is like it accounts for so many different parts of someone too. So how would you describe homeopathics if someone came up to you and was like, oh, homeopathics is a bit of hogwash? Like, how do you have that conversation with them?
Yeah, good question. Fortunately, not many people have come up to me saying that. So that's a good thing.
Yeah.
I can have that fury side of me as well. But truthfully, if you ask me my experience to homeopathy and how I see it, honestly, as a clinical homeopath, is that homeopathy works as well as most conventional medicines would. The homeopathy is obviously derived from nature. So, in terms of safety and efficacy, I would say it is obviously rates much more higher. The only challenge obviously that happens, and it happens with all kind of medicines, is patient's sensitivity. So if we don't understand the underlying cause of the patient, or if the patient is sensitive, or we are unable to identify the diagnosis of the patient, then no medicine will work, conventional or homeopathy or whatever. But when a patient is like, we know what's happening to them, so we understand the underlying cause, we understand the sensitivity, also we understand where the patient wants to go in their health journey. So if they want to lose weight, or if they want to heal the rash, or if they want to balance the immune system, which is probably what I would say homeopathy works best for. So any sort of autoimmune inflammatory condition, I see how wonderful homeopathy works. And also, it's, as I said, it's not a one remedy fix. It's always about the process, right? Because there's multiple factors that cause the immune system to get altered. So with homeopathy, I can see if we work on all those facets step by step and support the immune system in the best possible way, we really can see amazing results.
Yeah, absolutely. And I think for
Yeah.
children too, there is not a lot of things that mums have in their tool belt. I know I didn't, because nutrients that kids aren't going to really take herbs, like especially when they're infants and they've got things like teething, or they've got things like colic, or there's something's going on that you don't want antibiotics.
Correct.
Obviously, there's always a place, as you said, but it's like, being empowered to know that there are other options, and homeopathics really does bridge this massive gap, especially
Absolutely.
for really young children. Yeah, I think everything that you're doing is so amazing. And a little bit of a sneak announcement that there will be some first aid kits that will be being made very shortly that we are in the process of working towards, which is exciting. But
Absolutely.
I think from when I first started looking into homeopathics, it was a bit confusing to choose a particular remedy. And what I love that you do is you've accounted for all the possible options in your blends, which is, I think, groundbreaking and much easier to know how to treat. So
I like to add, but the reason why I have those blends, Emma, is that it's also something that's been created from years of experience and knowledge, and not just my knowledge. So all these blends are created, I would say, from 18th century medicine when homeopathy was first founded. And back then it was used as a primary source of treatment as well. And all these things are documented in our books. But the only thing is, and as we come later into homeopathic philosophy and lots of different people's method of practice, they have gone into what they call as classical homeopathy. And classical homeopathy means individualizing the case, working on the underlying cause, and working on a much more slower pace of treatment. And those kind of treatments do work really well for autoimmune conditions, or people with suppressed immunity. And I do follow that process when I see somebody similar like that. But when it comes to acute treatment, when it comes to a child who's got recurring infections when in childcare, or a child who, despite taking antibiotics, is not healing well, or even an adult, or even maybe whoever it is, if somebody who is constantly getting sick and is constantly needing conventional medicine and they need something more for their immunity, I think that's when homeopathy and naturopathics blends would work like magic, because it supports the immune system. It does that extra bit of work that your body is constantly asking for. And that's what homeopathy has always been known well for.
yeah, perfect. I love that. So if you could go back and tell your younger self something, what would it be?
Actually, it's funny you say that, because I do oftentimes speak that to my dad. Studying medicine was not easy for me. And it was not like it was a 5.5 years of full time studies and work experience. Because even when we were in our second year of medicine, we had to go to morgues, attend autopsies, understand how those reports are written. Third year medicine, we studied surgery. First year, we did do autopsies as well. We had to get, there was a process where our college was associated with one of the hospital setups. So any unclaimed bodies, we had to write reports, cut open just for anatomy. And it was disgusting, gory. Yeah. Even though that whole process, besides the whole study aspect, it was quite like, I even became vegetarian at that time. So you can imagine, I was like, it was a complete turn off. And for a person like me who was caring, empathetic, sympathetic, that part of studies was quite
masculine. Like that seems very masculine.
Very masculine. So I remember asking my dad that question, that is it worth it, and do I need to do this? And stress, definitely. I was extremely stressed for those 5.5 years. I must say I had a good bunch of friends, and I think thanks to their sanity, I think I survived through that. But without them, and without obviously Bollywood, because we used to go for any movie to escape from this stress. So thanks to Bollywood, I survived. But if you ask me what would I say to my younger self, I would definitely say it was worth it. Because at the end of it, when I see my patients getting well, when I hear patients say that if they're healing better, or their child's sleeping better, or the eczema is so much better, and whatever, like even like for adults as well with autoimmune conditions, they're not needing any more steroids, or they're not needing stronger medication, or even the fact that when they go for the scans or whatever, the disease is in remission. All these aspects which we see on daily basis, I think that's my reward. That's what I feel like. Every bit of hard work, every bit of vomits that I've done after the anatomy lessons, after, oh, it was terrible. I remember I tried different tricks as well. The reason I'm turned off from coconut oil or eucalyptus oil is because that's a smell we used to try to use to buffer those smells. And I'm completely averse to eucalyptus and coconut oil. And all those things are some, it's like at the end of it, it was absolutely worth it. I didn't practice in the hospital after that. So obviously that was a bit disappointing for my dad. But I think he's forgiven me for it, because today, in today's practice, I feel still good. And Emma, I think one of the things I like to add is I am seeing patients from overseas as well. So now I'm seeing patients from US, UK, New Zealand, Thailand, Dubai, all those places which have different culture, different exposure to diseases, different even nutrition supplements. It's fascinating how we're seeing those patients also heal. So that's also rewarding, to say that homeopathy can make a difference even if it's far away.
Yeah, yeah. Yeah, it's why can't it all be worked in together?
Absolutely.
Sometimes it tends to be only conventional medicine and then only natural medicine. But guys, people, if you're listening and you're on the fence, do them both. That's the point. You'll get better. Do you have any fears? Does anything scare you?
Oh, lots of things. Okay, it's a good question to ask. So obviously, I do have fear of this. There's a book written about there are only three types of fear. So fear of failure, fear of success, and fear of what people would think. I would say I always had the fear of what people would think. Because growing up in a family, and I was a young age, so obviously a high achieving family, hardworking family, I always obviously had a fear of disappointing my parents, fear of what people would think, and that would come as a norm. Having said that, Emma, for the last 5 years, as probably you would know as well, I do listen to different books. I do listen to podcasts. I read books on self development. I've also attended Tony Robbins' Unleash the Power Within, I think 3 years or 4 years in a row. And I've worked a lot on that particular fear. I think one of the books probably I would recommend on this podcast is it's a book called When I Say No, I Feel Guilty. And I would say that book probably has taught me a lot about how to overcome those fears. Having said that, obviously, fears do come into anyone's mind. It does come into my mind, but I do reflect back on the lessons that I have learned. And I oftentimes ask the question that if I didn't have this fear, what actions would I be taking? And that helps me overcome my fears.
Yeah, that's awesome. And I think that's so important to share. So thank you. That as women, we will have an inability to say no because we don't want to let anyone down. And that's something that generation upon generation gets shared. And I think now things need to change. It's okay to be taking your own power back and calling out when no, you don't want to do something. And if you want to do something, I don't care what people think. If it is for obviously good reasons, there's bad reasons why people should think about, but in that line of feeling judgment, am I good enough? Am I enough? Being able, even in health protocols,
Correct.
we find that at a base level, if someone has up-leveled depression or anxiety, it actually can often come from a place of self-worth. Correct. And not seeing a lot. It isn't just about nutrients. It isn't just about herbs, which is super important. It's like getting to the bottom of that energetic space. There is always that aspect. So thank you for sharing that. I have one more question before we wrap it up, because I am conscious of your time. If time and money weren't an issue, what would you be doing? What would be your dream?
Or helping more people. Definitely, Emma. I don't know. I've always visualized myself helping a mass population, helping people who, like even with primary healthcare, like simple things. Because I've come from a third world country and within Bombay. So Bombay is obviously a major city and it's a very populated city. You can see so many different dynamics within Bombay and how people's quality of life is different within Bombay itself. And there were some parts of Bombay which I had never seen until our college and our hospitals gave us those visits. And it would be so sad to see they didn't get primary health care. So simple things like even water, good quality food, this even knowledge of nutrition, like that simple awareness that what is normal and what's not normal, what you should do and what you shouldn't do. So even helping people break those norms, I would love to help more people. Definitely help more people even overseas with mental health. So even developed countries have a lot of mental health issues. They succumb to a lot of illicit activities. I would love to help deal with people and work with their nutritional, like their neurotransmitters in a more natural way rather than having to succumb to strong medication. So it's not, I wouldn't say I want to get people off antidepressants, but I want to help people not be on antidepressants, look at different alternatives, different habits that they can create so that they don't need to be dependent on stuff, or they don't need to feel depressed, need to be more stronger within themselves.
Yeah, that's amazing. It's actually similar to when Stacey had asked me this question. I was like, actually, something that's really close to my heart is working with this teenage range of women between 14 and maybe 18 who don't have the information around their cycle. They don't know how to work within that. And we only had the options of going on a contraceptive pill and somehow getting into schools and teaching it when it should be taught, not trying to backtrack when you're early 20s and all these things start to come up. Absolutely. So yeah, I working on that it's all about prevention, right? Starting and having that empowered health early on, or that information early on.
Correct.
Which is awesome.
I think the good thing is, Emma, what you're doing, what you and Stacey are doing is having these podcast series. So obviously you are now reaching out to more women who are similar minded as well, to know, let them know that there is help available. Like, it's not a new idea, like whatever you're thinking of, already somebody's doing it. But it's about bridging that gap. It's about letting people know that you can help them, that there is awareness there, which helps connecting with more people. So reaching out to people is definitely a good way to go through podcast.
Yeah, thank you. That's our vision. That's what we wanted. But thank you so much for joining me today and sharing your story and your vision. I would love to spread more awareness around homeopathy. I think there is so much need for it in the world these days. At some stage, maybe we can do like an isolated conversation around a particular condition. We see a lot of eczema in children, in kids. Maybe we could do a podcast around that specifically down the track. But thank you so much for your time. It's been an absolute pleasure.
Yeah, now with eczema, definitely, Emma, I would say that is definitely another passion, because most people again think it's only a skin condition. But as you also know, that it's more than just the skin. You have to work on so many systems. And surely I would love to talk about that.
Yeah. Sounds good.
Thanks, Emma. Thank you so much for the opportunity.
Pleasure.
And that's a wrap for today's episode. Listen, if you love what you heard here today, I would love for you to leave a super quick rating and a review. This helps the show get discovered by new people that need to hear what we have to share. Be sure to take a screenshot of today's episode and shout us out on Instagram, and we will shout you right back. You can find us on Instagram handles It's Stacey Turner and the.emma.McDonald. If you'd like to find additional resources or work with either of us, then DM us on one of these handles today.